point in time, lifting her hand up and holding it there wasn't really reproducing anything. So we didn't have the time. I couldn't actually have her up there staining hand above head for 10 minutes. However, I'll show you, you'll see in the video later, it didn't actually take that long. It wouldn't have been bad to see if that had any effect. But also to put a hand up here, no effect, so no sense in seeing if that changes the symptoms. Could ask her, because there's constant discomfort here in the front, does that affect your symptoms by changing your posture? No, it doesn't affect it. Even slumping for a little while, erecting, so no information gained there. Very strong predictor looking through the XPOS, especially with shoulder pain, spinal pain, would be that your posture affects the pain in the extremity. So functional baselines with this patient, again, holding a hand up there wasn't doing it. So we asked her to do that push up and show us, and you could see how she struggles to push up on that right arm of hers. Then quickly going through the movement loss of her shoulder. At that point, in every single movement, if she went into flexion, abduction, adduction, if she went into external, internal rotation, every movement had the slightest bit of stiffness at the end range when she did it actively. With the exception of internal rotation, which had a moderate restriction. So she couldn't internally rotate or put her hand behind her back as far as the other side. So that one was a little bit more restricted. When we look, but that stiffness, nothing caused pain. So no pain there. Passive movements, when we took her through all the movements, if I give her a little bit of overpressure to all those movements, there's no pain during movement. So at the end range, every time she tells me it's slightly stiff. And internal rotation, I'd like to think of that internal rotation or hand behind the back as three different movements. So you look at a bit of adduction, external, and just the pure rotation. At that point, it was more the adduction component. So treating that with passive movement, that was a little bit stiffer than the rest. However, even the extension, everything felt stiff. So the resisted test just showed stiffness. There was no real pain. So if we loaded that up, and you could do a brake test, give it as much resistance as you could, couldn't elicit pain. So none of the pain we could elicit. And if this is contractile dysfunction, if you give them sufficient load, it's going to be pain. Maybe you need to, and there's a reason we do the brake test. So the brake test we do is to avoid the passive pain response. So if there's passive pain through range, then you can't distinguish from that and the muscle power. So we do check the muscle power on its own, but always remember to load that contractile tissue up through range if you're not getting the pain down here, especially if the patient says the pain's up there. Doesn't just help resisting down here. You might not get that pain response. But in her case, going through all that, that's weak. That's general weakness. So that takes me, a lot further if you think about clinical reasoning. I'm seeing some obstruction of movement in the extremity, which is also one of the XPOS indicators. Looking at the XPOS study, if there is no movement loss of the shoulder, then your likelihood of spinal pain becomes much, much more. Doesn't mean that this can't be spinal. This can still be spinal, but it's starting to weigh in a little bit, all right? But you look at his spinal range of motion, and when we check that as she's sitting there, there's no limitation of spinal range of motion. In her case, that then also brings up, I'm going to have to look at the shoulder in depth. So we'll screen the spine, but definitely the shoulder case is building, especially looking at derangement and other, which will be very, the only way to differentiate between those two would be doing repeated movements.
Yeah. Mm-hmm.
All right. So
month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.